Okay, so this is a work of Marseille team about the spinal instability risk after UBE decompression surgery. To fix is not to fix. To fix or not to fix is the eternal dilemma of spine surgeons when you are talking about decompression surgery. In the literature, there is already well-known criteria about for fusion surgery with decompression surgery. So the presence of a degenerative spondylolisthesis, radiological instability, of course, the verticality of the facet joints. You have the facet joint effusions, you have advanced disc degeneration, and previous failure, of course, of isolated decompression. So in open surgery literatures, secondary instability is almost 8% of open laminectomy is associated with 8% of secondary instability and 11% of revision surgery. So with UBE, you have better postoperative improvement, you have a lot of different advantages. And the key advantage is the absence of atrophy of the multifidus muscles. So we ask ourselves the questions, those instability criteria in open surgery are the same for UBE surgery? This is a recent review which introduced a score for secondary instability after decompression surgery. So we conducted a retrospective study, and every patient with lumbar spinal stenosis or revision surgery were included. We didn't include spondylolisthesis because it's another study that Anna presented just earlier. We recorded every baseline characteristics, of course, and then every patient have postoperative dynamic lumbar X-ray at 3 months postoperatively. So we included 257 patients with a mean age of 70 years old and 30% of previous surgery. You can see the stratification according to the secondary instability score. So half of the patients have a low risk of secondary instability, and half of the patients had a medium risk of secondary instability. Among our patients on postoperative X-ray, we have almost 5% who had a postoperative instability defined as sagittal translation of more than 3 millimeters on postoperative 3 months X-ray. So these patients were on the low or medium subgroup of the SLE score. For postoperative outcomes, we reached good postoperative outcomes with significant improvements of the ODI score and the lumbar VAS score. Among the 5% of patients who present with postoperative instability, only one patient had to, only the fusion was finally performed in only one patient. So, of course, there are some limitations due to the retrospective nature of this work and limited follow-up. But we can already say that UBE decompressions represent a safe and effective procedures, and there is a very low risk of postoperative instability compared to open surgery because we have 5% of possible postoperative instability, VS 11% in open surgery decompression alone. So there is maybe the necessity to reevaluate the factors of secondary instability for the UBE decompression. Thank you.
Thank you. I don't know if there is any question in the room, any comment? Okay, so go for it.